So we're going to talk a little bit about disruption in asthma care. So we know that disruption occurs when an intervention takes place, and that intervention can be a conversation with a doctor and a patient. It can be a community health event. It could be a nationwide advocacy campaign. It could even be developing an asthma action plan for a patient. So we'll dive in first. We're going to talk on 3 different levels, the doctor-patient relationship. So first, start with Dr. J. Peters. Can you tell us a little bit about the role of communication and control and how that plays into adherence for a patient and that relationship between doctors and patients?
Sure. I think the first step is really understanding that, making sure that patients understand that chronic persistent asthma is really a chronic inflammatory disease of the airway. And if you really want control, then you really have to have shared responsibility where the patient and the doctor work together, as well as open communication. If you really think about it, one of the biggest problems is that asthma is variable. There's some days where they feel perfectly fine, and some days when they're having trouble breathing, coughing, or wheezing. Mm-hmm. And the reality is there's airway going on into the inflammation in the airway, despite the days they feel good or the days they feel bad. So when you look at the guidelines, you realize that any patient with asthma that requires their quick reliever medication, albuterol, 3 times or more per week, or anytime they wake up at night 3 or more times per month, either short of breath or coughing, that's a sign that the asthma is not controlled, that basically they require long-term controller medications. Mm-hmm. Even though we have really good controller medications, basically when you look at the CDC reports, they demonstrate and report that over half of children with asthma and 1/3 of adults with asthma each year miss either work or school. And so we have drugs, but we really need to communicate better, not only telling them that one drug doesn't fit or cure or control all of asthma, but also teach them how to use their medications. Each inhaler actually has different steps, and the patients need to be taught that. So I really think that the other key is the fact that so many patients have different triggers for their asthma. Mm-hmm. If you look at it, the physician and the patients really need to sit down and talk about what triggers their symptoms. And common triggers include everything from pets, includes molds, includes especially environmental tobacco smoke. And as we all know, it also includes pollution and also dirty air. Mm-hmm. So from a clinician's perspective, really the ideal would be for the physician and the patient to sit down, for them to understand their medications, for them to understand how to use their medications, and very important, to make sure that the physician develops a personalized asthma action plan so they know what to do when their asthma is in poor control.
Right. So Dr. Peters talked a little bit about that very one-on-one individual intervention. So tell me a little bit, Joel, about some of the things that your organization is doing at a community level to activate people to make change and create those disruptions.
Well, at Respiratory Health Association, we think about asthma and air quality in the community in terms of where people live and learn and play and seek their medical care. And probably a great example of this is that this is the 5th anniversary of the closure of 2 coal-fired power plants in Chicago, which were in economically underserved areas, and were built when President Eisenhower was in office. Those were closed in 2012, and we know from the research that was done that they contributed to asthma attacks, unnecessary hospitalizations, and by working with the community that owned and lived and worked and played near there, we were able to help lead a legislative effort to get those things closed down. Just this past year in Illinois, the Future Energy Jobs Bill was passed with a lot of support from environmental advocates and people affected by lung disease. That effort will reduce asthma attacks statewide by 1,000 a year. We think the key to that is empowerment, finding people who are touched by the mission, who are schooled in how to advocate for the mission, And with all respect to the political debates, the Fisk and Crawford power plants are not going to be coming back into business, and that's to the betterment of the health of our community here in Chicago.
Absolutely. Rudy, talk a little bit about some of the things the Chest Foundation is seeing nationally and ways that you feel your organization is moving the needle in terms of providing asthma care.
Sure. So, with the Chest Foundation and obviously our mission to help champion lung health, I think we feel that there's a strong responsibility of being able to bring patients, caregivers, the public, and clinicians together to move important things like having a better conversation, as Jay had mentioned, to empower them to be a part of their community that Joel's talking about. We're really lucky to partner with the likes of RHA and the Allergy and Asthma Network and Tanya that was speaking earlier, and then even better partners like Boehringer Ingelheim and Dyson, because they bring a certain perspective to the needs of ultimately to patients. Being able to move the conversation of how do we help patients have a different and better conversation? How do we help clinicians understand the perspective of where patients are? Right? To be able to have this kind of conversation, to convene different thought leaders to say, what are we doing to help people become healthier? And for us, having these experts, as well as bringing other people together, brings that unified voice. And for us to be able to be a part of that and to create one voice that's so much more powerful than the different disparate voices that typically happen on a particular topic.
Absolutely. I think we might have time if there are any questions from the audience for this panel. Any questions?
Oh.
Jay Rothenberg, Chicago, retired physician. I want to make a comment about the notations about coal. I had the opportunity as an 11-year-old to participate in one of the biggest coal-fired environmental disasters in history, and that is the Great London Smog of December 4th, 5th, 6th, 1952 in London. It was striking. The observations I made will stay with me forever. A line of double-decker buses being led by a white ambulance, led by a man in a white coat with a pocket torch, trying to find a corner where all the buses could turn to get back to the car barn. Noonday sun, dull orange. Smash and grab jewelry store burglaries of burglars who would throw a brick through a window and walk off with the contents. Shortly afterward, the government thought that about 4,000 premature deaths occurred from asthma and COPD. That total was later revised to 12,000. The upshot of it was that Parliament banned soft coal and more central heating occurred, and so asthma and COPD in London have decreased and the air is clear.
Right, I think Joel spoke to that, definitely.
Yeah, I mean, it's a terrible problem, and we need advocates, whether it's children with asthma, adults with asthma, healthcare professionals, to join us when we meet with legislators to educate them. The efforts to close the Fisk and Crawford power plants languished for several years due to the political process, and then when an aldermanic race was up, and all of a sudden people started telling the aldermen that it could affect their re-election, all of a sudden we had our support to get things done. It may not be the way it ought to be, but it's the way it is, and we need to be practical. Just supplementing my earlier comment, though, when we talk about the community, let's not overlook the role of the schools in helping children control their asthma and helping school personnel be ready to respond to asthma emergencies. You know, at Respiratory Health, we use the Fight Asthma Now program, which is a validated tool. We've educated thousands of kids, but there are thousands more who need that assistance.
Yeah, and just to piggyback on that, there was just an article that had come out about that over 50% of children with asthma are either not adhering to their medication or misusing their device. That is a horrific number, considering that kids and adults are still dying from asthma, no matter their severity level. Anywhere from mild to severe asthma, an asthma attack could eventually cause death. And so there is a clear need to say, what are we doing in the community, in the clinician office, to help create behavior change? And I think one of the ways is to continue to partner and bring people together, to speak with one voice, to make sure that we are finding the people that are not getting this information to help move the conversation forward.
Definitely. Well, we're out of time. Thank you. We appreciate your time.
Thank you so much.